In Marketplace Health today, Elisa Henry. She is live at a place called Capital City Chiropractic with some practical advice on how we should be listening to our bodies. They're telling us something. Mine are speaking bad things to me, but hopefully not you. Hi, Elisa.
Good morning, Sean. That's right. We are here at Capital City Chiropractic Natural Health Center, and I am with Dr. Bryan. Tell me your last name.
Schuetz.
Schuetz. I got it. Dr. Bryan Schuetz.
Very good, very good.
How long have you owned this practice?
20 years. 20 years I've been here this year, so it's been a long time.
And when people are thinking about maybe they want to see a chiropractor, how do they know it's time to come see you?
Well, I tell people, if you have a dentist, it makes sense to have a chiropractor. Your teeth are very important, and people get them checked. They floss and brush, learn how to take care of them. Nobody teaches you how to take care of your spine. So we try to encourage people to come when they're young. And if you ever have any kind of pain, that's telling you for sure you need to see a chiropractor.
What are some common issues people come with?
Well, low back pain is number one.
Okay.
And also a lot of headaches we treat in this office.
Really? So it's not enough to just take medicine?
No. I try to tell people, you take medicine for a headache. That's like, if your fire alarm goes off and it's telling you that there's a fire, and you just go up and hit it with a baseball bat and go back to bed.
Well, that would be good.
It makes no sense, right?
So when people come see you, first let's talk about low back pain. If people are coming to see you for that pain, what do you do to help them? Well,
we check their spine and see if they have any bones that have shifted out of place. It's called a subluxation. If we find that, then we can go ahead and help shift the bones back where they belong, takes the pressure off the nerve, and helps restore life to the body. And the pain relief is really just a side effect of what we do.
Is that in just one visit?
A lot of times we can get people better in one visit. Some people have more complicated conditions. I tell people if they've come in to see me when they're 30, it's like going to see a dentist when you're 30 and say my teeth hurt.
Whoa, really?
My eyes get big like that, and I'm worried about what's going on inside, because obviously there's a lot of degenerative changes that probably have happened because they didn't get checked when they were younger.
And what about headaches?
Headaches, we work on computers and text and everything now, so it puts a lot of tension on the neck. When that happens, it destroys the connection of the nerves to the body in that area, and most headaches are actually called cervicogenic headaches, or tension headaches, because the muscles pull and the nerves get pinched, and then you have a headache form because of it. So we can get rid of it just the same way by reversing that.
Wow, we'll talk more about that with you coming up next. We're going to go into his adjustment room and talk about adjusting, so stay tuned for that. Good morning, Sean. That's right. Now, Sean, I know that you had some problems. I know you had your car accident, the trampoline thing, so you could really benefit from visiting Dr. Bryan. And there are lots of people watching who could also benefit. And we have Veronica here. She's about to get adjusted, right?
Yeah.
So, Dr. Bryan, tell us, what do you do for people when you're talking about getting them adjusted?
Well, the first thing we're going to do is we're going to check their spine. So actually, I work on Veronica very frequently, so I know what's going on with her. I'll go down and just feel the bones in someone's spine. You can actually tell where they're shifted and where they're supposed to be. You can make that relationship, and then you can actually put them back where they belong if you find one that's out of place. It's pretty much simple as that.
Wow, and does it hurt?
No, it doesn't hurt. If it hurt, nobody show up. Nobody be here.
It seems like it was, but maybe not. Okay.
No, it actually feels really good to get adjusted.
And how do people know when they need to get adjusted?
Well, a lot of people, if you have pain, you definitely know you need to get your spine checked. But it'd be better to just have your spine checked once in a while so that you don't have to have pain and have all that problem going on, and just kind of preventative, kind of like you would for your teeth, to go to the dentist and brush your teeth and floss and things like that.
And what ages do you operate on people?
We work on people from birth to
babies.
We have patients almost 100 years old.
Wow, so anyone can benefit from this.
Oh yeah.
And what other types of services do you offer here?
We do some nutritional work here with people when they need it, and we also counsel people on stretching and activities that they should do at home, that sort of thing.
So for someone watching, what's something that they can do right now to help their body feel better?
Well, if you have a friend, have them look at you and make sure that your spine is straight, your shoulders are straight, your hips are straight. When your eyes are closed, have them check you from behind and look and see. And if that's off, it's an indicator you have a spinal problem. Also, looking at it from the side, you should have your ear lined up with your shoulder, lined up with your hip, and lined up with your knee and ankle. That should all be a straight line. If it's leaning forward like this or back too far, then you need to have your spine checked.
I'm really checking my posture here.
I saw you when I said that.
Yeah, I was like, I gotta stand up straight.
Yeah.
Well, I'm gonna go back to you, Sean, but I have to check this out. You're gonna give me a massage, right?
Yeah.
That's why I'm here. That's why I'm here. Back to you.
Oh, Elisa, it's all about you. What the heck? Share the love.
Oh my God.
Well,